Headache associated with travel. I'm Dr. Nadeem Sajjad Raja. A headache is pain or discomfort in any part of the head. There are several types of headaches and many factors can cause them. There is a category of headache which is attributed to aeroplane travel. This is under a large section called headaches attributed to disorders of homeostasis, while patients with migraine and cluster headaches are more likely to be affected. One can also have a headache without having a history of headaches in the past. Headaches should have a few of the following features. Headaches occur during a flight, worsening pain with initial takeoff or start of landing, and improvement within 30 minutes of taking off and landing. Typical headaches can be one-sided in the orbital or frontal region and jabbing or stabbing quality. A side shift can occur in about 10% of the cases. Migraine features may also occur, such as pulsation or throbbing. So what is the mechanism of aeroplane travel headache? The underlying pathophysiology is still unclear but may be related to cabin pressure changes, possible localized inflammation related to the ethmoid sinuses. Flight simulated studies have shown an increase in inflammatory markers. Both frontal and maxillary sinuses are innervated by the trigeminal nerve branches. The trigeminal vascular system is involved in the underlying mechanism of migraines. Other mechanisms may be related to stress, vasoconstriction, as well as hypoxia. What should we treat? Symptoms can be very disabling for some, to the point where travel is self-restricted. Any anatomical or sinus disease should be ruled out. Medications that have been tried, including simple analgesics such as naproxen, ibuprofen, and acetaminophen. More specific medications such as triptans have been tried in the past that have a history of migraines. I think all of us may have also tried to open and close the jaw or chew to equalize the pressure. Then our ears get clogged during flights. From anecdotal evidence, a trial of a newer class of migraine medication called gepants that target calcitonin gene-related peptide can also be helpful. However, it may be about the timing of medication before taking off and or landing. Other helpful tips: if you have a history of migraines, you may want to discuss with your health provider about preventive medication. You should also bring your acute medication with yourself. Hydration is very important, as well as not skipping a meal. Remember, this headache is after all under the category of homeostasis. For longer travel, and if you think you are going to nod off, a neck pillow may be beneficial so that you don't get whiplash. Cervical strain can certainly lead to tension or occipital headache. As always, your patients should always discuss with their primary care provider before taking any action prevention. Understanding the triggers of travel headaches is key to avoid them. Each person may have unique triggers for their travel headaches. A person may be able to avoid a headache by mentally preparing for the situation and trying to increase their tolerance for triggers. People who need medication may need trusted source to sedate themselves before travel to reduce risk. Thank you very much for watching this video.